Mr. Alvarez was one of my patients in the emergency department. He was working in his yard, and we received a call from the paramedics, noted sudden onset of severe left-sided deficits. He was unable to move his arms and legs and had a lot of facial droop.
When they put me in the ambulance, I was laid down, left side of my body, and it was not moving at all. I can move anything at all. It won't respond, not even my eye, my voice, my legs. And inside me, it feels like it was electroshocks.
So we got the call based on the paramedics' assessment. I made him a stroke alert. And when we have a stroke alert, we announce overhead and we get all the services, including CT and lab and all the techs and the nurses and pharmacy and everyone we need on board. At that point, I called the telestroke physician and had him on the TV set above the patient so that when the patient was wheeled into the room, it was like having a specialist right there over my shoulder.
In the care of Gustavo Alvarez, I was the telestroke neurologist on call that day. I logged on to the telestroke system and was able to see video of him as he arrived. I was immediately able to see he was suffering the signs of stroke with weakness on one side of his body. It was then recommended he receive the TPA treatment for stroke. He was rapidly taken over the CT scanner and rapidly received treatment, giving him the best chance at recovery.
The earlier patients get treatment, the better off they do, and the less complications that they have. We know that if the TPA is given within 90 minutes, that the patients have a much better outcome. And in this scenario, it was given in 22 minutes.
TPA stands for Tissue Plasminogen Activator. It's a medicine designed to dissolve blood clots. Therefore, for the most common type of stroke, which is caused by blood clots, the goal of that medication is to dissolve that blood clot and improve blood flow back to the area of brain that's at risk.
What TeleHealth does is it allows us to have 24/7, 365 days a year of subspecialty care that we can consult with. If our current resources maybe don't provide that subspecialist or if they're unavailable at that time, and especially when it is a time-critical situation like stroke.
It was the efficiency in the hospital, the medicine, the time, everything counts.
When it comes to stroke care, time is brain. And so it's very important to be able to deliver care in a very timely fashion.